Ever wondered why healthcare costs so much? That's a question many of us have asked at some point. It's a topic that's not only relevant to us as individuals, but also to nations as a whole. The cost of healthcare isn't just about the financial strain it can put on our wallets. It's about the impact it has on our quality of life, our ability to work, and our overall well-being. Let's take a moment to consider the vast disparities in healthcare costs around the world. From the high-tech hospitals of the United States to the community clinics in rural Africa, the cost of care varies dramatically. This disparity isn't just about the difference in healthcare systems, it's also a reflection of the economic realities and healthcare priorities of different nations. Understanding healthcare costs is the first step towards making informed decisions about our health and well-being. So, stay tuned as we delve into the world of healthcare costs. In America, healthcare costs are a major concern. Indeed, the United States is notorious for its exorbitant healthcare costs, which are among the highest in the world. But why is this the case? Well, it's a multifaceted issue, tied to a variety of factors. One of the primary culprits is the cost of prescription drugs. The United States spends more per capita on pharmaceuticals than any other nation. This is largely due to the fact that drug prices are not regulated in the US, allowing pharmaceutical companies to set their own prices. Consequently, life-saving drugs that are affordable in other countries can be prohibitively expensive in the US. Another factor contributing to high healthcare costs is the complexity of the American healthcare system itself. A great deal of money is spent on administrative costs. These include the expenses associated with billing, insurance-related activities, and the plethora of paperwork that healthcare providers must deal with. In fact, administrative costs in the US are significantly higher than in other developed countries. Then there's the issue of price transparency, or rather, the lack thereof. In the American healthcare system, it's often difficult to know the cost of a procedure or treatment ahead of time. This lack of price regulation and transparency can lead to wide variations in the cost of the same service, depending on where it's provided and who's providing it. Despite this, it's crucial to remember that high costs don't necessarily equate to high quality. While the US does excel in some areas of healthcare, such as medical research and certain specialized treatments, its overall health outcomes do not reflect the high costs. Life expectancy and infant mortality rates, for instance, are not as favorable when compared to other developed nations that spend considerably less on healthcare. The American healthcare system certainly has its challenges, but it's not the only one. As we move through this exploration, we'll look at the healthcare models of other regions around the globe, each with their own unique set of strengths and challenges. We'll delve into these in the coming scenes. Stay tuned for a fascinating journey into the world of healthcare costs. Across the Atlantic, the European healthcare systems tell a different story. In the heart of Europe, we find some of the world's most exemplary healthcare systems. Let's take a trip to the United Kingdom, where healthcare is considered a fundamental right. The National Health Service, or NHS, is a publicly funded healthcare system that provides coverage to everyone ordinarily resident in the UK. It's free at the point of use and paid for through general taxation. The NHS stands as a testament to the belief that good health should not be a privilege for the few, but a right for all. Next, let's jet over to Germany, another country that's made significant strides in healthcare. In Germany, healthcare is funded by a statutory contribution system that ensures everyone receives medical attention when they need it. This system is funded by both employers and employees, with the cost equally split. The result? Comprehensive health coverage that doesn't break the bank. These European models emphasize the principle of solidarity. No matter who you are or where you come from, you're entitled to healthcare. It's a system where the healthy support the sick, the young support the old, and the wealthy support the poor. It's about ensuring that everyone, regardless of their circumstances, has access to quality healthcare without the fear of financial ruin. But it's not all roses. These systems, too, face their own challenges. Long waiting times in some cases, and a heavy tax burden are some of the hurdles these countries grapple with. Yet, they continue to innovate and adapt, striving to provide the best care for their citizens. Of course, the European model isn't the only way. Each country has its own unique set of circumstances and challenges, and what works in one might not work in another. But as we look for ways to improve healthcare around the world, the European model offers some valuable lessons. While Europe has found some solutions, other countries offer different models. In Asia, countries like Japan and Singapore have unique approaches to healthcare. Let's start with Japan. In the land of the rising sun, every resident is required to have health insurance, whether it's through their employer or the national system. This mandatory health insurance covers a large portion of healthcare costs, making it affordable for all. But that's not all. The Japanese government plays a key role in controlling healthcare costs. They set a standardized price for each medical service and treatment. Yes, you heard that right. Every 2 years, the government negotiates with physicians to decide on these prices. This regulation ensures that healthcare remains accessible and affordable for everyone, regardless of their income. Now let's fly over to Singapore. Singapore's healthcare system is well known for its efficiency and effectiveness. It's a mixed healthcare system, combining mandatory savings, insurance, and government subsidies. The Central Provident Fund, or CPF, is a compulsory comprehensive savings plan for working Singaporeans and their employers. Part of this fund goes towards MediSave, an account used to pay for personal or immediate family's hospitalization, day surgery, and certain outpatient expenses. This system encourages personal responsibility, while also ensuring that healthcare is affordable. In addition to this, the Singaporean government regulates healthcare prices and heavily subsidizes public hospitals. They also provide 3 types of health insurance schemes, each designed to cover different aspects of healthcare. This multi-pronged approach helps to keep healthcare costs low while ensuring high-quality care. Both Japan and Singapore have managed to achieve impressive health outcomes with relatively low healthcare spending. And while they may not be perfect, these systems show how cost-effective strategies, such as mandatory health insurance and government regulation of healthcare prices, can lead to accessible and affordable healthcare. These Asian models offer a different perspective on managing healthcare costs. They show us that it's not just about how much money is spent, but also how it's spent that matters. This is a lesson that the rest of the world could definitely benefit from. Down under, Australia combines elements of different systems. The Australian healthcare model is an intriguing hybrid, incorporating both public and private healthcare providers. This unique blend allows Australia to offer its citizens a multitude of options, providing a level of flexibility that is often admired by other nations. The backbone of the Australian healthcare system is Medicare, a universal healthcare scheme funded by taxpayers. Medicare ensures that all Australians have access to free or low-cost medical, optometrical, and hospital care. It's a crucial safety net that guarantees no individual is denied medical attention due to financial constraints. But Australia doesn't stop there. Alongside Medicare, the government encourages citizens to take out private health insurance. This dual approach not only relieves pressure on the public system, but also gives individuals the opportunity to access a wider range of services, such as private hospital care, dental care, and physiotherapy. To ensure this system is sustainable, Australia has implemented several strategies to control healthcare costs. One such strategy is the use of a community rating for private health insurance. This means that everyone pays the same premium for the same level of coverage, regardless of their health status, age, or lifestyle. This approach discourages cherry-picking by insurers and ensures everyone can access private healthcare at a fair price. Another cost control measure is the Pharmaceutical Benefits Scheme, or PBS. This ensures that all Australians have affordable access to necessary medicines. Under PBS, the government negotiates with pharmaceutical companies to obtain the best prices for drugs, which are then passed on to the citizens. However, like any system, Australia's healthcare model is not without its challenges. Balancing the needs of a diverse population with the necessity to control costs is an ongoing struggle. But through a combination of universal coverage, private insurance, and strategic cost control measures, Australia has crafted a healthcare system that is both inclusive and financially sustainable. Australia's hybrid system provides yet another model for healthcare costs. It's a testament to the country's commitment to ensuring that healthcare isn't a privilege, but a right for all its citizens. In Africa, healthcare costs present unique challenges and solutions. As we turn our attention to Africa, we're stepping onto a continent where healthcare costs are intrinsically linked with issues of accessibility and affordability. The vastness of the continent, coupled with its diverse economic landscape, creates a unique scenario in terms of healthcare economics. In many African countries, the majority of the population lives in rural areas, where access to healthcare facilities is limited. This geographical divide often translates into financial barriers, as the cost of transportation can be prohibitive for many. On top of this, the out-of-pocket expenses for medical services can be exorbitant, making healthcare unaffordable for a large segment of the population. However, despite these challenges, Africa is not without its solutions. Innovation is the name of the game, and mobile health technologies are at the forefront of this revolution. These technologies are helping to bridge the gap between rural and urban healthcare, and in many cases, are making healthcare more accessible and affordable. For instance, mobile clinics are delivering essential healthcare services to remote areas, reducing the need for patients to travel long distances. In addition, telemedicine is enabling remote consultations, ensuring that patients can receive medical advice without leaving their homes. This not only reduces transportation costs, but also makes healthcare more accessible. Another innovative solution is the use of mobile money platforms for healthcare payments. These platforms allow patients to pay for healthcare services using their mobile phones, eliminating the need for cash transactions. This not only makes healthcare more affordable, but also more convenient. These innovative solutions are not only transforming the healthcare landscape in Africa, but are also setting an example for the rest of the world. They demonstrate that despite financial and logistical challenges, it is possible to deliver affordable, accessible healthcare through innovation and technology. Africa's experiences highlight the importance of innovation in managing healthcare costs. So, how do all these systems stack up against each other? When we look at the global landscape, it's clear that healthcare costs and systems differ greatly from region to region, each with its own unique strengths and weaknesses. Let's start with the American model. A key feature of this system is its high expenditure, largely due to private sector dominance. On the flip side, it boasts cutting-edge medical technology and a competitive market for health services. However, the cost barrier often restricts access for many citizens. The European model, particularly the Nordic countries, provides an interesting contrast. Here, universal healthcare is the norm, funded largely by taxation. While this results in high taxes, it also ensures equitable access to healthcare for all citizens, regardless of income. Yet long waiting times for certain procedures remain a concern. In Asia, healthcare systems vary widely. Some regions like Singapore have a blend of public and private healthcare, where the government ensures affordability, while private sector competition drives quality. However, in less affluent regions, access to quality healthcare can be a significant challenge. The Australian system offers a hybrid model, combining public healthcare with optional private insurance. This dual system allows for choice and competition, resulting in high-quality care. But costs can still be a hurdle for those without private insurance. Meanwhile, in Africa, the scenario is quite different. Many countries struggle with inadequate funding, resulting in limited access to healthcare services. Yet there are promising initiatives, such as Rwanda's community-based health insurance, showing that innovative solutions can emerge even in resource-limited settings. In summary, each system presents a unique blend of costs, access, quality, and innovation. The American model excels in technological advancement but grapples with accessibility. The European and Australian models offer universal access but face challenges with cost and wait times. Asia showcases a range of systems with varying degrees of success, while Africa, despite resource constraints, is home to innovative grassroots solutions. As we can see, there is no one-size-fits-all solution to healthcare costs. Each system has its merits and challenges, and the quest for a balanced approach continues. Healthcare costs are a global issue, demanding innovative and flexible solutions. Across continents, we've uncovered a myriad of approaches to this pressing concern, painting a picture of a world united in its quest for affordable, accessible, and quality healthcare. In the United States, we've seen the high costs of medical care driven by a combination of factors, including the price of drugs, administrative expenses, and the cost of new technologies. The European model, on the other hand, offers a contrasting perspective with its emphasis on universal healthcare, funded largely through taxation and compulsory health insurance. Shifting our gaze to Asia, we discovered a diverse landscape of healthcare systems, some heavily reliant on out-of-pocket expenses, others leaning towards government-funded models. Down under, in Australia, we found a blend of public and private sectors working in tandem, striving to strike a balance between accessibility and quality. In Africa, the struggle against healthcare costs takes a different shape, with the focus on improving infrastructure and combating diseases. The continent's diverse healthcare systems underscore the necessity of context-specific solutions. As we've journeyed through these varied landscapes, the complexity of healthcare costs becomes evident. There is no one-size-fits-all solution. Each system, with its unique challenges and strengths, contributes a piece to the global healthcare puzzle. This exploration underscores the need for ongoing research and reform. We must continually evaluate and learn from these systems, adapting and evolving to meet the changing needs of our global population. Perhaps the answer lies not in a singular approach, but in a hybrid model that borrows the best aspects of each. The cost of healthcare is not just a national concern, it's a global challenge that requires global solutions. It calls for cooperation, understanding, and a shared commitment to ensuring that every individual, no matter where they live, has access to the healthcare they need. Remember, the key to affordable healthcare lies in understanding and learning from these different systems around the world.